Welcome to ConnectCare3 Matters of the Heart Conversation. I'm Elizabeth McKay, one of our nurse navigators here at ConnectCare3, along with my colleagues John Lawton and Donna Penny, my fellow nurse navigator. And today we're going to be discussing heart health and why Americans are chronically sick. And we have to ask ourselves why this is, considering the abundance of resources we have at our disposal. And just for some statistics, 1.5 Americans suffer a heart attack or stroke each year, which causes over 800,000 deaths. Heart disease continues to be the number one killer worldwide, and people under 70 account for 1/3 of those deaths, according to the World Health Organization. So today we're going to focus on heart healthy habits that we can take to minimize our risks. And we're going to start out with Jonathan today. So, John, what are some of the simple habits that people can incorporate into their daily life to help improve their cardiovascular health?
Yeah, so there's obviously plenty of different ways. There's exercise, diet, stress management, sleep. We'll touch on each of these as we progress through this conversation today. But I'm going to start out with the exercise piece. And so first things first, when you start an exercise program, make sure you obtain clearance from your doctor. That way, you're lowering your potential risk for an event to happen. As we've heard too, I'm guessing many of us have heard to exercise 150 minutes per week. That's physical activity or exercise, and there's a difference, but we're going to focus more on the exercise piece, which is structured with the intent of gain. And so moderate intensity exercise would be between 50 and 70% of your heart rate max, and vigorous intensity would be between 70 and 85% of your heart rate maximum. So to figure out your heart rate maximum, you take 220 minus your age, and that would be your rough estimated heart rate maximum.
Okay.
So then you take 50% of that to get the lower end of the moderate intensity to 70%. So multiply 0.7 times your number. Yeah. Then also you want to make sure that you know the difference between the moderate and vigorous. So when you're exercising, if you're going at a pace where you can talk to someone throughout your exercise, then you're going at a moderate intensity. Then vigorous is when you're having trouble maintaining a conversation throughout.
Because you're having to catch your breath.
Exactly. Yeah. So that's more so on the cardiovascular side of things. We also can see benefits through resistance training, flexibility, and even balance training. They all have their own little benefits. High intensity interval training is a big thing these days, which really can reduce your stress and improve your heart health. But minimize that to 2 to 3 days per week, because if you do it too much, then you can overexert.
Right, and not everybody's ready to go into a high intensity workout.
So again, making sure you're talking with your doctor and getting that clearance.
Well, thank you for that. And, I think it's something that everyone needs to consider, to just incorporate at least 2 to 3 times a week of exercise.
Yeah.
And so, Donna, we're going to move to you. From a medical perspective, what types of cardiovascular health screenings should we be thinking about?
So regular health screenings, because high blood pressure and high cholesterol can damage your blood vessels and your heart, they're absolutely essential to know where you stand. A yearly physical with a blood pressure evaluation is important. Your body weight, knowing what that is, if it's going up, if it's going down, if it's staying the same. Your blood glucose level, your cholesterol levels should be checked every 5 years after the age of 20, unless you're advised differently by your physician. Some people with a higher risk of cardiovascular disease or high cholesterol, familial high cholesterol, may need to have theirs checked more frequently. When you do have your cholesterol levels checked, it includes your total cholesterol, your LDL, your HDL, and your triglycerides. So that's what they're going to be looking at when they do that. And then over time, as people age, there are different parameters and that are age specific and risk specific that you can talk to your physician about that
Mhm.
can be implemented for you. So
Okay.
it can be very individualized.
I know you mentioned the LDL and the HDL. Those can, again, going back to the exercise piece. By exercising, you can lower your LDL,
Yes.
but that's where your HDL can
Yes.
actually increase.
Yep.
And some of the best exercises to do for those is to do isometric exercises like planks and wall sits.
Mhm.
So, doing those a couple times, there was a study doing it 4 times per day can show significant benefit. And the study said to do for 2 minutes, but again, if you're just starting out on an exercise program, 2 minutes is going to be a long time to hold that
Yeah.
specific exercise. So, again, start where you are, use what you have, and do what you can.
Mhm.
So, if you can only hold it for 10 or 15 seconds, that's fine.
Yeah.
But build up from there. And another key piece to doing any isometric exercise is to make sure that you're breathing throughout.
Right. You're not
Don't-
holding your breath.
Right.
The plank, causing more stress for your
Yeah.
body.
Yeah.
So doing the breathing while you're holding and,
Yes.
working up to the 2 minutes, like you
Right.
said.
Yeah.
But I think those are great recommendations because they're simple and it's
Yeah.
something that, people can incorporate 8 minutes a day into
Yeah.
their daily routine. So thank you for that.
Yeah.
And, on to lifestyle risks, Donna.
Mhm.
What are risks that we should, again, remind our listeners? Most people have heard these, but it's important to just continually reflect upon risks that we can.
So there are definite lifestyle risks out there that put you at a higher risk for heart disease, starting with diet.
Mhm.
If you find yourself eating high saturated fat, trans fat, foods with high cholesterol in them, those are things to look at. Read your food labels, know what you're eating. Same goes with sodium, because that's going to contribute to high blood pressure. So read the food label, look for that information. Know that it should, when you're looking at that content, sodium content, cholesterol content, whatever, fat, it should fall between 5 and 20%.
Right. Or better yet, eat foods that don't have labels. They're actual real.
They're actual
Whole
real
foods.
foods. Yeah, exactly. Yeah. Jonathan talked about exercise and how important that is, because if you aren't someone who is out exercising, you lead a sedentary life, that's going to contribute to weight gain, high blood pressure, high cholesterol levels. All of that comes into play there. Diabetes as well. That definitely impacts that. Alcohol also can raise your blood pressure, raise your blood sugar, raise your triglyceride levels. Limiting your consumption of alcohol for women to 1, beverage a day, men 2 beverages a day is definitely going to be beneficial. And then smoking is huge, because smoking can damage your heart, your blood vessels. It increases your risk for the cardiac conditions that you mentioned when we first started talking. It also, the nicotine in the cigarettes can raise your blood pressure. Yep.
Right.
The carbon monoxide
And your pulse.
and your pulse, yes. And the carbon monoxide from the cigarette smoke is going to reduce the amount of oxygen that you're taking into your lungs and
Mhm.
into your body. And then, of course, there's secondhand smoke, which is dangerous to people. And a lot of laws have changed that don't allow that in public places anymore. But
Right. To expose
Yeah.
people that don't want to be exposed to it.
Exactly. And of course, sleep. Sleep is huge, and it's totally underrated by people. Average 7 to 8 hours a night if you can, because that's going to be beneficial to you in terms of allowing your blood pressure to take that time to come back down to where it should be, and to because if you're not getting that 7 to 8 hours of sleep, your blood pressure stays up over the course of the night.
Right.
And if you are getting those 7 to 8 hours, then it gives it that opportunity to recover. Getting enough sleep is also good for type 2 diabetes, because it can improve your blood sugar control, as well as weight management. Because when you get enough sleep at night, the part of your brain that is that controls hunger has that opportunity to get a break as well.
Right,
So
it's a
then-
fasting state, so your
Yeah.
body is recovering and
Exactly.
allowing your pancreas to recover
Mm-hmm.
and your blood sugar to return to normal.
Yeah.
Exactly.
So you mentioned several times about diabetes. The pre-diabetes. 1 in 3 Americans have pre-diabetes, and then 1 in 10
Yeah.
have diabetes. So and then also with the smoking side of things, a way to a lot of times people are smoking maybe because of stress.
Right.
If you replace that with like a walk instead of going outside for a smoke,
Exactly.
Mm-hmm.
then you're kind of killing 2 birds with 1 stone. You're
Really helping yourself
Yeah.
a lot.
So
Yeah, you're allowing your body to repair as well as receive the endorphin response of
Right.
just heighten, it decreases your stress and heightens your mood.
Yeah.
It makes you feel more relaxed. So,
yeah, one of the common themes here obviously is exercise is medicine.
right.
And there is an organization out there, it's through the American College of Sports Medicine, called Exercise is Medicine. So,
Good resource.
Exactly. Well, thank you. And so, John, what are some types of food considered heart healthy that people can think of to incorporate into their diet daily?
yeah, that's a great point. Omega-3 fatty acids are great for your heart health. Fish and nuts are 2 of the top ones that come to mind, especially the nuts, because they're quick grab and go, great snack. They can help you feel full, and they provide the omega-3 fatty acids and also some micronutrients as well, like magnesium, potassium, and copper.
Yeah.
So significant benefits there. And then the fish, some people do have seafood allergies. Obviously, if you have a seafood allergy, don't incorporate this one. But there's been studies done that really show a decrease in heart disease risk if you're consuming fish on a regular basis, up to 20 grams a day for a week can reduce your
Be beneficial.
yeah.
Yeah, I think that's so important to understand the protective benefits of fish
Right.
for heart health. And, I also read that it improves insulin sensitivity. So people that are pre-diabetic
Right.
or diabetic can benefit from adding fish into their diet weekly. So thank you for that.
Yeah.
And going on further,
Okay.
adding snacks. I mean, what can people do when they head off for their day, whether they're traveling in their car for work or they're at an office, they work from home? What can they do to prepare themselves so they're not being tempted by snacks that are available that are not healthy for us?
Yes, great point. And I think one of the things that my wife and I have found out recently is really prepping beforehand. And when we go shopping for fruits, especially strawberries is one of the new ones for us, because we all, in my family, we all love them. If we cut them up right away, they get eaten rather than going to waste. But
Right.
one of my best go-to snacks that I encourage is cottage cheese with berries, because with the cottage cheese you're getting some fat, protein, and then you add in the berries for some of the antioxidants. It's a great
Vitamin D.
vitamin D, yeah,
Calcium.
calcium,
Yeah.
you
It's a
name
good-
it. It's
good go-to snack.
Yep.
Right.
The nuts, avocado.
Yeah.
You always
Yogurt.
mention.
Yeah.
Yep.
Lots of good choices out there.
And cut up raw veggies, carrots, celery,
Yep.
broccoli, whatever you like as a vegetable. Just getting it prepared, cut up so it's not just sitting, in your fridge or in your vegetable drawer, waiting to go bad.
Yeah, exactly.
What would you guys think would be a good dip for something like that?
Peanut butter and
Yeah, a lot
celery.
of people like peanut butter
Very good
for like their
together.
celery or their carrots, or
Yeah.
hummus is another good dip.
Yes.
We always like to have hummus on hand because that way you're not going towards, it also makes you feel full and it's healthy for you. People can make hummuses at home themselves if they like doing that with a blender, or they can buy a pre-made hummus. Just make sure it doesn't have a lot of additives in it.
Yeah.
So, but you can make your hummus even more healthy by adding like garlic and different, flavors and herbs and things like that.
Yeah.
So, well, those are great ideas. So thank you.
Yeah.
And also, speaking of stress and anxiety, so if someone is in an acute stress situation that they just maybe heard some bad news, or they are having some like a difficult project at work, and they're feeling like a deadline coming that they're just feeling their stress level heighten, or they're sitting in traffic, whatever. What kind of recommendations can we give to people that can just instantly lower their stress response?
Yeah, so a couple of the ways that you can bring your stress response down. If you're able to, get outside, go for a walk. There's been studies that show getting out in green spaces, tag along a buddy, grab someone and go for a walk and talk with them.
Mhm.
It helps you kind of disconnect. And also you can do a breathing technique that you would inhale for 4 seconds, hold your breath for 7 seconds, and then exhale for 8 seconds. And this would be a good one for being stuck in traffic.
Yeah.
If you're by yourself, especially, that's a great way to just take in all the air through your nose, hold it, and then really exhale through the mouth.
Just
Okay.
good clean cleansing.
Right.
Yeah.
Yep. So just
So like mind body techniques where you're allowing your mind, you're allowing not the stress to take over your thoughts, but you're instantly intervening with with an exercise that lowers not only negative thinking but your stress response, like
Yes.
your elevated heart rate, maybe your blood pressure is going up, and then you can decompress and think more clearly.
Yes.
So, and we had also talked about meditation techniques, just not meditation where you have to go into a meditative room, but just something you could do even if you are at work or you're out, you can walk outside real quick. What do you suggest for meditation?
Yeah, so one of the great ways for that is to find somewhere to sit, whether it's in the grass or on a park bench. And it's called the 5, 4, 3, 2, 1 technique. And that's to see 5 things, 4 things that you can feel or touch, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. And what that does is it really helps your mind disconnect from everything else and like really focus, because it's a challenging task, especially thinking about 2 things that you smell,
Right.
or maybe even 1 thing that you can taste. But as you get down, it gets harder and harder. So,
right, and it's redirecting.
Yes.
right.
It's allowing you to be in the moment
Yeah.
versus racing thoughts into a place that maybe you have no control over. So
Yeah.
a meditation brings you to the moment you're in.
Yep.
And makes you connect with your surroundings.
And disconnect from the stress.
Right, exactly. And I think those are great ideas. So thank you. And I think, we're going to wind down now. So we've shared some good tips and just kind of making our listeners think about their heart health and going, talking with their primary care physician, also some self-care techniques they can do. And I wanted to ask both of you, what credible websites can you suggest to our listeners that they can find credible heart healthy information?
So the American Heart Association is really good. They offer not only information, but like recipes and exercises that you can incorporate into your day. The Mayo Clinic and the Cleveland Clinic are fantastic websites as well. Easy to read. The information is presented in a nice way with pictures and, again, recipes that you can access. And WebMD is also another good one. And I think you have a couple.
Yeah. Exercise is medicine, and also Healthline. Those are some great resources as well. So,
I've seen Healthline actually has little videos that you can watch if you want to do a good plank or a wall sit. You can watch a video that directs you with the proper body mechanics or whatever exercise
Right.
you're going to do.
Yeah.
So thank you for sharing that. So that's our presentation today, and thank you for joining our conversation. And ConnectCare3 is here to assist you with your healthcare needs. So thank you very much.